Hello, everyone. I am Dr. Georgitta Valiyamattam, and I am a consulting psychologist. I have been working in the area of developmental disabilities for a couple of years now. And on the occasion of World Autism Awareness Day today, I'm really glad to be sharing a few thoughts with you. Autism is a condition, I guess, that many of us are aware of today, probably due to the rising incidence. For instance, a very recent research study published this January in the Journal of Pediatrics noted that autism rates had tripled among children in the New York and New Jersey metropolitan areas between 2000 and 2016. And this is a trend that we find elsewhere also across the globe. Multiple factors may be contributing to this kind of rise in incidence, including genetic and environmental factors, which we are still not fully aware of. We are not aware of what are the specific factors that are contributing to this. And perhaps the rising incidence can also be explained due to better diagnostic mechanisms that are available to us today. While we find a lot of information regarding autism being passed around, probably due to the rising awareness, it is also important to note that not all of this information is correct. So today, I will be briefly going over some basic autism facts. Many of these facts may be aspects that we are already aware of, but it is always good, I feel, to go over these basics and to recheck our understanding of autism. So the first question is, what is autism? So as many of us may be knowing, autism is today referred to as Autism Spectrum Disorder, ASD. It is an umbrella term and it is used to describe a group of neurodevelopmental conditions. So initially, a couple of years back, we used to have different diagnoses such as autistic disorder, Asperger's disorder, childhood disintegrative disorder, Rett's disorder, and pervasive developmental disorder. So all of it today has been clubbed under the common umbrella of autism spectrum disorder. And because it is an umbrella term, what we also have to remember is that there are a wide variety of symptoms and manifestations that are getting clubbed together under this umbrella, which is why we often say that if you meet one individual with autism, you have probably met only one individual with autism, because that is how the symptoms may be going or showing a very unique cluster. It is not that because you have met one individual with autism, you get an idea about a couple of other individuals with autism or how the disorder is like. The disorder will have a very unique manifestation across individuals. However, across these unique manifestations, we have certain commonalities. And these commonalities include difficulties in communication, difficulties in social interaction, social attention, and restricted and repetitive patterns of behavior. This include narrow interests, obsessive interests in certain, what we can call it as restricted or narrow areas. And this can also include certain repetitive behaviors, motor behaviors, or interests in certain subjects, which are very, very prominent. Another aspect is that autism spectrum disorders are not limited to any population group, to any specific race or culture. They are found in people around the world, across races, across ethnicities, across cultures, and across economic backgrounds, and in both the sexes, that is, in males and females. So autism may be less reported from certain races or certain ethnicities or certain socioeconomic groups, but this in most cases is due to the lack of awareness and due to the lack of economic opportunities, not because there is a lesser or a greater incidence in a certain group. So, of course, the incidence of autism is rising. Some recent reports pin it at 1 in 36 children being identified with autism spectrum disorder. And the incidence is much higher in males, 4 times higher in males as compared to females. Autism can follow two kinds of patterns. It can be a progressive or a regressive pattern. So progressive pattern indicates a progressive increase in communication and interaction difficulties, a progressive increase in social difficulties, and in other kinds of restricted repetitive behaviors. Whereas in a regressive pattern, you have the child developing normally for some period of time, or developing typically for a certain period of time, and then you find a loss in, say, social communication, social interaction. So there is a regression that we find from typical development. And in both these cases, the symptoms usually appear between 12 to 24 months, and in most cases before 3 years of age, whether it is a progressive pattern or whether it is a regressive pattern. Regarding the risk factors for ASD, because this is something which is being discussed, we still do not know much of the specificities regarding what are the risk factors that lead to autism spectrum disorder. But at a broad level, it is seen to be a combination of environmental factors, biological factors, and genetic factors. For instance, birth complications, parental age, when it is when you have the parents being older, genetic factors, because we have a lot of sibling studies in autism which show that a sibling of a child with autism also has a 20% or more chance or a higher risk in developing autism spectrum disorder. So there can be a combination of factors. And over the years, we have realized that certain factors which were earlier considered responsible, for instance, vaccines, are not risk factors for autism. Autism is a combination. The risk factors for autism, in fact, are a combination of several factors. We can only say that certain things may predispose an individual or increase the risk that an individual has in developing autism spectrum disorder, but we are still far away from pinpointing the exact cause. So beyond these basic facts, now the question arises as to how is autism diagnosed? One thing we must remember is that an autism diagnosis involves multiple steps. I say this because in clinical practice, we often find autism diagnosis being given out way too easily, probably due to the fact that people are more aware of this disorder than certain other disorders, or it can be a combination of factors that are leading to this. But often the autism diagnosis is given out without a proper understanding, or without a proper consideration of all the possible factors that may be involved. So what is important for parents to remember is that an autism diagnosis is a difficult process. In fact, it involves multiple steps. And one of the first steps is developmental surveillance. This is where your pediatrician, your child psychologist, your healthcare provider will ask you for the child's developmental history. In fact, the parental role is very, very important in an autism diagnosis. Often, and most often, in fact, it is when the parent notices some kind of delay or some kind of atypicality in the child's development that he or she approaches the healthcare provider, and from there we have the autism diagnostic procedures getting into place. So a healthcare provider also will ask you as a parent for the child's developmental history, your own observations regarding the child, about what are the skills that the child has, what are the behaviors that the child is displaying, what are the kind of delays or deficits that you are observing. So some of the common deficits that you may observe is that from birth, like even from as early as 2 weeks of age, the child has difficulty in maintaining eye contact. By 9 months of age, approximately, the child is not responding to their name. Approximately around the same time, the child is not displaying facial emotions or facial expressions that reflect emotions, for instance, surprise, anger, and so on. And by 12 months, usually children can give hand gestures, like, they wave, or they engage in some kind of interactive games such as, peekaboo and things like that. But you find that the child is not doing that. And by 15 months of age, usually children engage in some kind of interactive play. For instance, if the child has a favorite toy or something of a game, the child will try to show it to others or try to give it to others and engage another person into the child's play. But that is not happening. Or by 16 months, 17 months, you're not finding the child, you're finding that the child is not saying any words, or, it's not developing any kind of vocabulary or speech. The child, maybe 17, 18 months, the child is not pointing, or if you point somewhere, the child is not looking there. So there is this lack of joint attention. And by 2 years of age, approximately, the child is not noticing emotions in others, is not responding to emotions in others. For instance, if you are crying, or if you are sad, or if you are hurt, the child is not responding in some way, either by gestures or by facial expressions. So the child is lacking in facial expressions of emotions by himself or herself, and at the same time is not noticing emotions that you are expressing, and is not speaking any meaningful words, or what we call two-word phrases. And you will find these deficits as the child grows to 2.5 years of age, approximately. Deficits in pretend play, imaginary play. We often find children, playing with dolls, caring for dolls, or saying that I am a teacher, or I am a nurse, or I am a doctor, having all these kind of imaginary pretend play. But you understand that the child is not engaging in these kind of things. Or, any kind of turn-taking games, whether a child is engaging in play with another child of the same age or another adult. That is not happening. The child is engaged in more of isolated play behaviors. And this may also involve loss of speech, loss of skills, as I said, in the regressive pattern, where the child was developing typically for some period of time. But it can be sudden, it can be gradual. You find that the child is losing the skills that the child already had. Apart from that, restricted and repetitive behaviors or interests are very important manifestations of ASD. So you may find the child lining up things, or playing with toys in the same way, lining up things, being interested in certain things, for instance, hanging objects, or certain topics. Maybe a child may be interested in dinosaurs, so the child will just be trying to collect as many pictures or of dinosaurs. Or even if the child is speaking to you, has some kind of verbal interaction, it will be only about dinosaurs or things like that. And the child is obsessed over these, has certain unusual interests, and maybe showing some stimming behaviors, or certain patterns like tiptoeing, or moving from one toe to the other, rocking behaviors. So these may be certain other things, along with hypersensitivity or hyposensitivity, maybe dislike of loud sounds, dislike of even the textures of certain clothes. So when you are trying to get the child to wear a certain kind of a different dress than what the child is usually used to, or a different material, the child raises a huge tantrum, is very picky in eating, wants to eat the same things over and over again. Probably if you are introducing anything new into the schedule, whether it is in terms of the texture of clothes, or whether it is in terms of a new routine, or a new food item, or a new toy, the child has difficulties in adjusting to these. And the child may also show certain sensory seeking behaviors, for instance, sniffing things, licking things, kind of peering or looking at objects out of the corner of their eye. Any new object, the child will try to sniff and get a sense of it. So these are all certain unusual behavior patterns which can be indicative. So this is, of course, not an exhaustive list, but these are some of the common behaviors that parents notice, and which can be important for the healthcare provider to understand the child's development. After the healthcare provider gets this information from the parents, the next step would be developmental screening. And developmental screening usually involves certain questionnaires, checklists that the psychologist or the pediatrician will employ. And the basic motivation behind using these is to understand whether the child is deviating from typical development. And if the child is deviating, how much is the child deviating? This is not a diagnosis. This is just a screening to understand the extent of deviation and if there is a deviation or not. And if the healthcare provider feels that there is a deviation, then we go into the formal evaluation. There are many gold standard tests for autism diagnosis. There are tests which are standardized to Indian conditions as well. So the healthcare provider, usually a psychologist, a qualified psychologist, or a team of individuals, a child psychologist, a pediatrician, a clinician, team of clinicians together would engage in, and sometimes you may also have a neurologist on the team, you may have an ophthalmologist on the team, because autism is also something which has a lot to do with vision and visual atypicalities. So it is often good to have a team of individuals who provide their information and their inputs regarding the child's development. And finally, it is usually a clinical psychologist who gives you the formal evaluation or conducts the formal diagnosis and provides you both the diagnostic evaluation reports on standardized psychological scales, which indicate that the child has or does not have autism. And if the child has autism, what is the level of severity that the child is exhibiting. So another factor that is very important for us to understand is that autism can be accompanied by other issues or what we call comorbidities. It is very rare for autism or any other condition as such to exist in isolation, and often we have a series of comorbidities or accompanied or associated conditions that occur in individuals. So some examples include, say, feeding issues, sleep issues, gastrointestinal problems, epilepsy, intellectual disability, attention deficit hyperactivity disorder, which is often abbreviated as ADHD, anxiety, depression, obsessive compulsive disorder, learning disabilities, visual issues, motor issues, and in certain rare cases, other mental health conditions such as schizophrenia and bipolar disorder. Now, this is again not an exhaustive list, but the reason why we are talking about this is to understand that autism may be accompanied by other conditions, and it is very important to have a team of professionals dealing with the management of autism, so that many of these issues are also identified and tackled so as to manage autism in the best possible manner. Often when many of these issues are ignored, or individuals are unaware, or parents or caregivers are unaware of these other existing conditions, the management of autism becomes more difficult just because of the fact that these accompanying conditions were not managed. Very, very importantly, this is something we need to understand, and we need to tell ourselves over and over again that there is no cure which exists for autism spectrum disorders. This is because every time there are new parents who have a child diagnosed with autism spectrum disorder, they often get lured by promises of autism being cured. And the very word cure is something which we should be, very, very aware of, that it is not a possibility with autism. And in fact, the very theme of 2023 is about understanding the fact that we do not need a cure for autism. It is about transforming the narrative. It is about accepting autism as a neurodivergent condition, and with due respect and due regard to the difficulties that are accompanied with it. It is also about appreciating this neurodiversity and, supporting the kind of contributions that this very neurodiversity can bring about to the society, appreciating the kind of roles, the very important roles that individuals with autism can play, and fostering those. So it is not a condition, that can be cured. It is something that can be managed, and it is something which, with the right kind of support and the right kind of acceptance, it can, lead to enhanced lives, or, enhanced contributions from individuals having these, diagnoses. Again, what we require is a multi-pronged approach to autism management. This is something we have been talking about in diagnosis, as well as when I spoke about the comorbidities that accompany autism. Again, I'll repeat that even in autism management, what we require is a multi-pronged approach. And usually there are a number of approaches and a number of professionals who can help in the management of autism. Some of the common therapies that are used include behavior and communication therapies, for instance, applied behavior analysis and behavior therapies. Other behavior therapies are most commonly used for tackling problem behaviors, for enhancing social communication and interaction. So this is more of a process where you reward the right kind of behaviors that the child displays, and try to help the child generalize these behaviors to other scenarios. Slowly, helping the child practice those behaviors which will enable him or her to adjust to the demands that the society places on them. So there can be a host of behavior therapies and a host of applications of these therapies, and they are considered to be one of the most effective mechanisms for managing autism and the symptoms therein. Apart from that, we have educational therapies, which focus on developing some individualized educational paradigms for these children, because that will again help them in ways that they can get the maximum possible benefit from the education that they are receiving. So it is more about creating structured, individualized programs for educating these children, improving the skills that they are having deficits on, and having intensive programs which help the children navigate through the educational paradigms or the educational systems that they need to be in. Apart from these, family therapies are very effective because these help families train themselves in how to be with these children, how to interact with children, how to promote skills, whether it is social interaction, daily living skills, or how to manage problem behaviors, because at any point of time, there is only a certain limited time that the child is in a school, whether it is a regular school or a special school or in some other therapy program. And a large part of the time that the child spends is at home. And therefore, it becomes very important for the parents or the family as a whole to understand how they can participate in managing autism. So family therapies focus on that. Of course, we have other therapies such as speech therapy to improve communication skills. We have occupational therapy, which teaches children daily living activities. There is physiotherapy to deal with motor issues and other related problems. And there are a host of complementary therapies as well. When I say complementary therapies, these are therapies which support existing therapies. Say, examples include art therapy, music therapy, animal-assisted interventions. So it's a known finding by now that children with autism find it easier to interact with animals as compared to humans, and that animals act as social lubricants and act as de-stressors for children with autism. So sometimes complementary therapies such as animal-assisted therapy harness the presence of an animal as a means for the child to engage better in other kind of therapy such as behavior therapy, or to engage in social communication. So there are a host of complementary therapies as well that can be looked into. Apart from that, there is counseling, because there are children who are undergoing, as I said, comorbidities such as depression, anxiety, and related issues, which can be dealt with appropriate counseling. And medications, again, medications are not meant to treat autism or to cure autism per se, but sometimes in case of comorbid conditions, for instance, hyperactivity or anxiety or depression, severe depression that the child is having, there may be cases where the medical practitioner prescribes certain medications or supplements for the child. But again, this is something to be done under, in fact, all these therapies and medication is something which has to be supervised and has to be prescribed and planned by a qualified medical practitioner. Yes, as I said, medications are not meant to cure or treat autism per se, but to treat certain conditions that may accompany or to alleviate certain other problems that may accompany autism. And very importantly, there is no one-size-fits-all treatment for autism. So this is something which parents have to remember, because what works for one child with autism may not work for another child with autism, because the symptom manifestation and the entire, kind of picture of autism differs from one child to the other. So one therapy which works for one child may not work for another child. So it is about understanding in depth what are the needs of the child, what are the kind of capabilities that the child brings onto the table, and then determining, it may also be a bit of, trial and error, understanding what are the needs, what works best with the child, what is the child responding to, and then catering to the child's requirements. For instance, it is very easy for us to say that a certain behavior is a problem behavior, say stimming or repetitive behaviors are considered problem behaviors, but this may not necessarily be problem behaviors, because these kind of repetitive actions or stimming can help the child, manage overstimulation or understimulation. So sometimes there are adults with autism who say that as children and as adults, these stimming behaviors help them, while engaging in these stimming behaviors, they could express certain difficult emotions, or it helped them deal with anxiety. So it is very important to understand, how do we define a behavior that the child shows? How do we define the specific needs of the child? And how do we cater these therapies or these interventions to the child's needs in a way that it enhances the child's daily living skills? So finally, I would put in some quick tips for parents, because parents often undergo a lot of stress. Parents of children with any kind of developmental disability, it is a very stressful scenario. And these are some quick tips for parents that I will put in before I close. So the first very important thing is to observe your child's development carefully. This is very, very important, because even before the diagnosis, after the diagnosis, your observations are what matter the most. You are the person who is with the child for the greater period of time. So make sure that parents of very young children, as the child is born, it is very important that you follow the child's development, the milestones the child is reaching, the milestones the child is missing, note down whatever observations you have, and interact and discuss this with the healthcare practitioner, because this is where you may be able to identify certain symptoms or manifestations of autism early and start intervention early. And don't wait for a diagnosis. If you feel there is something missing, start with intervention. Of course, the diagnosis may take some time, as different healthcare providers, different professionals sit together, work on it, administer the kind of standardized tests that need to be administered, and finally reach a consensus. But that should not prevent you from starting intervention. If a child is having a speech problem or a communication difficulty, you can start with therapeutic procedures for that, because the earlier the intervention, the earlier the start of the intervention, the better are the outcomes. So start intervention as soon as possible. Keep observing your child's behavior. And this is very important: structure, safety, routine, new experiences, because children with autism thrive when there is a structure, when there is a routine, because they feel safe within that routine. So try to provide as much of that as possible to the child, because the child will thrive when there is a structure or a routine. But that should not be a limiting factor for new experiences for the child. So make sure you take the child wherever you are going, give the child new experiences, because slowly the child will get accustomed to these new routines. So prepare the child ahead of hand. You want to go to the supermarket, you want to go outside, to a park, you want to go anywhere, to your workplace. See if you can, have your child accompany you. Don't feel guilty about it. Don't feel stigmatized. don't feel scared, because if you are getting anxious, the child can easily note your anxiety. Also, the child will again get anxious. So be confident, prepare the child ahead of hand that, this is what the child can expect. And slowly expose the child to newer experiences, because that will help the child generalize whatever the child has learned within the safety structures that may be there at home or there at school. That will help the child generalize it to newer areas or newer situations. And develop non-speaking methods of communication. Communication is often a big deficit area in autism, but also because we often focus only on verbal communication. Touch, pictures, your own, tone of voice, all these gestures can all be communicating mechanisms. So even when you cannot probably effectively communicate verbally with the child, there are other means of communication that can be used to convey to the child your feelings and to help the child feel safe, to help the child feel secure. So try to see, how does your child communicate? Just because the child is not using words, that doesn't mean the child is not communicating. See how does the child communicate, and try to cater your communication to the needs of the child. And pay attention to sensory issues, because many times the biggest roadblock children face in dealing with new circumstances or new scenarios is the kind of sensory issues they have. This may include hypostimulation or hyperstimulation. And sensory issues may be a wide variety of issues. It may be auditory, it may be visual, it may be tactile. So this is again your observation and your experiences which will help you understand what is difficult for the child. And you can also communicate to the child in simpler ways to see and understand what is difficult. If you observe, you may see that there are certain sounds that the child is getting hypersensitive about, or certain lights or certain colors. So, and this may be a unique pattern for each child. So try to understand what are these sensory issues and be prepared for circumstances where the child may encounter such sensory issues. So as far as possible, you can avoid it. But when you know that you are going into a new circumstance, if you're prepared, you know that these are the issues my child has, you can prepare for it. And you can see what are the ways in which you can calm down your child, you can protect your child in those kind of scenarios. And as parents, particularly as new parents, I feel, there are a lot of new parents who come in because they have received a lot of advice from different sources, and they have gone through a lot of failures, both of which is normal. You may get a lot of unwelcome advice, including, certain scenarios where people tell you that you are responsible for this condition. But please do not fall into that guilt trap. There is no research which says that, parents are responsible for the autism diagnosis, and you are doing your best at your level. Believe in that. You may receive a lot of advice, but go with what the experts say. Probably discuss with other parents. That is why I often say seek support, give support. Because you have to understand your capabilities, your limitations, and try to join support groups of other parents. And there you may get a lot of, genuine inputs regarding what these parents have gone through, what has worked for them, what has not worked for them, and be ready for failures. Because although all of these advices may be good, what has worked for another child may not work for your child. So it is again a trial and error process in many ways, where you try to determine what is the best route possible for your child. And give support, because it also makes you feel a lot more empowered when you're able to support another parent, or when you're able to support, say, research studies, participate in things like that, which will make the future better for children with autism. So seek support, give support, and pay attention to yourself, because I see a lot of parents who are going through a lot of burnout because of the caregiving responsibilities that they have. So take time out for yourself without guilt. See what are the activities you can do which will help you feel better, because that time is that, me time that you will have is very important also if you want to, take care of your child. So these are some of the quick tips that I would probably give to the parents. So on the occasion of World Autism Day today, let us remember that awareness is strength. It is very important to understand what autism is, to try to keep seeking out more information as it comes through. New researches are happening. So keep seeking out new information. Keep consulting professionals, other healthcare practitioners, so that you can understand autism better. For parents, keep observing your child so you can understand your child's needs better. And yes, autism cannot be cured. It is not necessary also, because the neurodivergence that autism involves can be extremely useful to the society as well. What is important is that we support each other, we support parents and families who have a child with autism, and remove the stigma that is associated with autism and, in fact, all other developmental disabilities, and empower each other. Thank you.